Hi, I'm Mary Beth Stapleton, Manager of Family and Community Partnerships for Harford County Public Schools. Welcome to our first virtual Parent Academy Real Talk. Today I have with me Christina Alton, who oversees our mental health services for Harford County Public Schools. Hi, Christina.
Hi, Mary Beth.
Good to see you today.
You too.
And before we get started, just so everybody knows, we are both in our homes, so you may hear children or dogs or husbands, right? Because we're all working from home and trying to make it through the day. So please excuse noises ahead of time. So Christina, could you just kind of share your background a bit for the families about your experience and your work?
Sure. Mary Beth, I'm a social worker, and for everybody who's watching, I'm a social worker and have been one for probably longer than I care to remember. I am the mental health specialist for Harford County Public Schools, and I've been with the county for 12 years. Prior to this, I worked in one of our schools, Magnolia Middle School, as a social worker in our classroom support program.
Wow, that's awesome. So you were providing direct services for families for a very long time.
I was.
Awesome. Well, thank you for your service. I know you have done probably, gosh, thousands of people's lives have been impacted by your work. So that's amazing. So to get us started, just to kind of guide us through, first things first, this is an incredibly stressful time for our families. I know I'm feeling it. I know people in my circle are feeling it. What can we do as parents just to kind of help us get through the day and help us deal with all of those things that are coming up in our thoughts around that perhaps could cause anxiety or stress?
I think one, I'm feeling that kind of stress too. I'm right there with you, Mary Beth, as I know everybody else is too. I think that for parents, this is for right now our new normal. And I think what's most important is to work with our kids, be where they are. And that's sometimes hard to do. They're afraid, they're frustrated, they're excited because they're not in school, but they're also mourning the fact that they're not in school. And I think the more that we can, I just read an article in I believe it was the Washington Post, and it was written by a pediatrician, and she talked about maintaining a schedule, but as best you can, not we're going to do 6 hours of schoolwork and this and all of these things that it's
well, let me interrupt you there because I'm seeing many things on Facebook and sharing of, oh my gosh, right? So we have to wake up from this time to this time, and then we have to have yoga, and then we have to have class. And, I think that, and parents are trying to do their own work, right? And trying to do their own deliverables for their employer, or they're having to go out and work as a first responder. So all of these things, right? So I guess what you're saying is maybe just take a step back from that.
Yes.
Yeah. Okay. So not so much it has to be a certain way every day.
Because, things are different. This is not how our children are used to learning. Some of them may thrive in this environment. They may like it. They may enjoy that I can work this long on this subject. I can stop. I can go to something else. I can circle back to it. I think that we preach to our kids all the time about spending time on social media, and that what people post isn't always what's real. People only post the good stuff. And one of the social workers said to me today, Kim, who works at Deerfield Elementary School, and I told her I was going to quote her. She said to me, "We are comparing our worst to someone else's best." When we get on social media and we see folks that are really doing a bang up job, and I applaud them for that. I wish sometimes I could be that way. But we need to do what works for our children. We need to do what works for our family. There are some guidelines that are out there as far as, how many hours, coming from people who homeschool regularly, how many hours elementary school students should be working, how many hours middle school kids, and how many hours high school kids should be working. And mixed within that, the traditional paper, pencil, books, and things like that, but also recreational things. They get those opportunities when they're in school, being able to get up and walk around. And, if you want to stand up at the dining room table and do your work, I'm good at that. My daughter works outside every day. She has out on a porch on the side of our house, and she goes out there, wraps up in a blanket, the laptop's out there, and that has been wonderful for her. She sits out there literally all day.
So what
And
works for your child, pretty much?
absolutely. And I think, what I read in this article before I just came on to you from the person, the pediatrician who wrote it, she also said to think about this. This is a memory that's going to stick with your child forever. It is going to be a thing that they will always look back on, no matter what grade. I know for our seniors, this is going to define what their school year looked like, but it's for every kid. When they go to a high school reunion, they're going to say, remember back in 2020 when we were all, quarantined, that this is going to be the thing. And so to mark that as a family, and how will you do that? Because we can think of it as being stuck at home, or we can think of it as being safe at home. And kids are going to take their lead from us as adults.
So if we're calm and we're confident and we're, and to be honest, I think as parents, sometimes we're so how's this grade and how's this GPA and are you thinking about this step and that step? Maybe just taking a step back from all that and just saying, let's just be safe and healthy right now, right? Let's just make sure we're all okay, right?
And being calm for our kids doesn't mean that we have to be rigid either. That showing calm and sometimes when I teach some of the classes that I do, sometimes we have to fake it a little until we make it, and that we might be dying on the inside as parents, and we can take our private moments to just stop and take a deep breath, and you've got this, and you find your way to help yourself, whether that be meditation or reading a book or taking a walk. I walk every day in my community because that helps me. It's keeping me in a good space so that I can be there for my family. And I think the more that we can show that to our kids, but also let's have fun a little bit. One of the suggestions that was made in this article that I read is maybe keep a family diary and either write in it, everybody writes in it, or maybe you're dancing and singing and recording it so that you can look back on it. At my house, we have a jar, and it's our plans for after COVID. And each day we're all putting something in it that we're going to do when all of this is over. And my plan is for us to look at them as a family and to be able to say, boy, is that really what I thought I was going to do? And have I done it? And, because one of my things is not to worry that I'm going to get sick every time I walk out of my house. I'm really looking forward to that. And I think that's really super important for us to maybe develop some of those things that we can do with our families that are fun, and to let go a little bit, because if we show them that as adults, our kids are going to relax a little bit too. And it might encourage them to share some of their anxieties and their fears, because we're comfortable. We don't have to, when our child says to us, I'm afraid, or I just don't even know what's going on, maybe what we can say to them is, we can't control this. We cannot control COVID. We can't control the having to stay in our homes, but we can control ourselves. We can control how we go about our day. We can control if we participate in some meditation, or if we watch a movie, or if we have a meal as a family, if we cook a meal as a family.
Or play a game together or something like that. Yeah. Yeah. Well, and that said, I mean, so that's why, back to that point about the routines, it's probably going to vary day to day, depending on what your workload is, and such. And, I don't have small children anymore. That's a whole other layer.
It is,
because I have teenagers. And so I know they're pretty much self-sufficient and I can check in, but my gosh, the extra layer of stress for parents with young children right now, when they're trying to do their own work and they're also trying to care for their children, that's got to be just a struggle for all families right now.
I can't even imagine. I have a 17-year-old, so that's not, the dog and the cat rely on us a little bit more than she does. I think that's, if you have that smaller child, and again, I think that being able to be a little bit more flexible with your time, but maybe that for everybody, if you can, when it's time to turn off, it's time to turn off.
Yeah.
That if you have a schedule scheduled work day. I know I'm trying really hard that if the notification for an email goes off beyond what my work day would be, I'm trying not to answer them or looking at it, but maybe not writing a reply. And I want my daughter to do that as well, that this is when we're cutting it off, or this is when we're starting in the morning. For her, I said 8:30, let's try for 8:30. Let's shoot for that, because she was pushing it a little bit and I had to bring back that limit and boundary. And it wasn't a bark, it wasn't a command, it was a, hey, why don't we try this tomorrow?
Yeah.
And her response to that was very positive, because I didn't say, hey, you need to get up earlier. This is what, it wasn't like that. It wasn't like that at all. And I know sometimes we have to be that way. Me too.
Sometimes. So thinking about our stress and our, anxiety or issues with it, what are some signs that we may perhaps need to reach out for some professional help for ourselves? Like, when do we think perhaps maybe it's time to find somebody? And I know everything for mental health right now is telehealth, right?
It is. It's all telehealth now. So that makes it in some ways a little bit easier to access, because regulations have been relaxed. It's only for the time of the governor's decree. For some of it, you can get your therapy via telephone right now. That's never been allowed before.
Oh, wow. Okay.
So that's the only thing that's required for a face-to-face is an intake if you're not currently involved with a therapist. I think that it's a little bit relative. I think as we're observing our children, knowing when to reach out, and also for ourselves. I think what looks like it's out of the bounds of what is normal for you and your child is when we need to think about getting help. So, for example, a teenager, they love their time alone. And it's important that they have that time alone. But when they are maybe not even coming out to have meals, or deciding that they're not answering the FaceTime calls that seems to be coming in, at least in my house, with regularity. When they don't want to do that, when they're just up in their room and maybe they're sleeping more than they usually do, that when it's out of the bounds, when they don't have an appetite, it's not just, I don't feel hungry right now, but just, I don't want to eat at all. Maybe they're crying and it's more so than usual. Anything that they're feeling more strongly, or that you're feeling more strongly than usual, not being able to get out of bed, excessively tired, all of those times, those might be times when you might even reach out to, because physically you may feel that you need to reach out to your doctor who's also doing telehealth. I think that anything that is out of the bounds of normal that makes you go, especially trusting your gut, that maybe this isn't right. Maybe I need to reach out. That is okay to do. And I will say to parents out there that are watching, your school counselors are available through email, the school social workers, if you're lucky enough to have one, and your school psychologists are available in that way. So if you're not sure where to turn, be in touch with them. They can refer you. They can let you know. And if they're not sure, they'll reach out to me and I'll help with it. So I think in your gut, if you know it's not right, if it's not normal for your child, it's time to reach out, and don't be ashamed to do it. There is, nothing more powerful than reaching out and having someone say, I can help. And there are people who can still help. Great.
So we can maybe put some resources on to kind of clarify where people can go and make sure that that's clear. That's awesome. And remembering that, we are hundreds and hundreds of families are going to be dealing with stress, either because of health situations or because of economic loss of job, et cetera, or both, right? So we, fortunately right now in Hartford County, our cases aren't as high as other counties, but that could change. So just remembering that, first things first, take care of yourself so then you can take care of your kids, depending on the stressors that are coming at you.
And I think that, sometimes when there are struggles, the reason, it feels worse because we feel like we're alone. And the interesting thing about this situation is that we are really all in this together. Yeah. Everybody is having to change what their previous life was from just a few weeks ago, even a week ago, because it seems like things change. But this, if nothing else, you're not alone, because this is really a shared experience for families. Mm-hmm. Some people are impacted differently because they have lost jobs. Maybe somebody's sick. But the overarching reason for all of it is the same for every single one of us, is that this is a shared experience, and there's a lot of comfort in that shared experience. Your individual experience with COVID, it might be different, as I said, with the loss of a job, or maybe you have someone in your home that has to work more. Maybe
Right.
a first responder in your home. Maybe you have somebody that works at the grocery store in your home, and any or a professional who is a doctor or a nurse, and that's your experience. But we all are in this together. I think that as I see things, humanity has been so amazing to me. When you look and you see videos of people in New York and Chicago hanging out of their windows and applauding doctors and nurses who are going into hospitals, or my husband's a first responder, and people from our community are sending food to them. He's like, I'm going to get fat. Because all
That's
these people,
okay.
he loves it. And it's wonderful because our community as a whole is caring so much for people who are out there on the front lines, and if any good comes out of this, it's that we're supporting each other in that way. The school system and the people who are going out every day and feeding our children and handing
The food
those
service
meals.
workers. Yeah, and so did you know Chick-fil-A donated lunches every day, and then Aberdeen Proving Ground Federal Credit Union, they're giving them a Friday. Thank goodness it's Friday pizza today. So
That's wonderful.
yeah, but to your point, I think everybody's going to be eating a little bit more than they used to that are first responders. So wow, that's so true. But just to remember, kind of going forward, where we can get our help for mental health. So for example, like we talked about, if you think something's just not right, for a child, would you start with their pediatrician?
I think you can start with the pediatrician. You can also you can look for resources. You can call 211, which is that statewide resource where you could
the United Way.
Yeah, the United Way. You could start there. There are resources that they can get you to. I think that starting with your pediatrician, they are there. Telehealth, some of their offices might be busier than usual, and some of them might not. You might actually be able to access one of the professionals in the office sooner. Again, be in touch with a resource within our school system. We have a lot of wonderful professionals, our school psychologists, our school social workers, our school counselors, who can also point you in the right direction.
So parents could reach out to their school's counselor and start there? Okay.
Absolutely.
Yeah, and they would just find that email in the directory.
Yes, and if you're not sure and you know if you know a teacher's email, which most of us do because we should have been contacted at this point, I know I have been, ask a teacher and they will get you in touch with the school counselor. I think that's a great way to reach out. And again, we know about resources. We know which of our community providers provide. We have community providers in every single one of our schools in Harford County. And so we could even point you in the direction of the community provider that's already within our school.
So when you say community provider, that's a mental health person.
Yes.
Or mental health agency.
Yes, that are in each of our schools. And so we might be able to point you in the direction of the person that's already, the agency that's already assigned to your individual school. So that continue on, and they meet with students in school so that when we return, your student might be able to continue with that person right in their school.
Oh, nice. Before we end, I just want to touch on something that I think you already mentioned, which is kind of the grief part of this, especially for our class of 2020. There's just so many milestones and markers that have already passed that they just, they're just gone. And so how do you deal with that grief, right? I mean, that's hard. I think denying it is probably, from a professional's perspective, not a good idea because it's going to come up in another way. But we are dealing with grief on so many different levels and so many different markers in our lives. What do you suggest we do to kind of handle that grief?
I think with any emotion, labeling it is really super important, and being able to call it what it is. And there's a quote by Mr. Rogers, and it's talking about when we label things, we make them human, we make them real, and then we can start to discuss them and we can address them. And so I think people might be hesitant to call it grief because grief is associated with death, but grief is really about loss. And I couldn't agree with you more, Mary Beth. There are children who have been looking forward to the last, what was it? I think they had 44 days of school left when we were at our last day.
Yeah, and I mean, we really don't know what's going to happen in the next few weeks.
don't.
But even there were special times for seniors, I know in March and,
Yes.
early April that probably are past already. So,
And it's a loss, and we need to let them grieve that, because it was a big deal to them. And even though as adults, we might think, oh, well, it was just, but we were all there. We were them at one time. And I can remember all of those things, as a senior in high school, or as you're about to graduate from college, or whatever the case may be, that we need to give our kids and all the people around us permission to grieve all of those things that we've lost. People have lost weddings. People have lost, we were talking about Easter in a meeting that I was in just before, and what that's going to look like, and the loss of that family time, and really call it what it is. It's grief, it's loss. And it's okay that we're sad about it. It's okay to cry about it. It's also okay to talk about it. And okay, so maybe we won't do it then, but we are still going to have a graduation party, and this is what it's going to look like. And you know what? These are all the things that we are still going to do. It might not look exactly like we wanted it to. That's going to be okay, because I think it goes back to, but we still control how we're going to do things, and how we mark occasions. And so that giving ourselves permission, labeling it what it is, the grief and the loss that we're feeling, talking about it, being able to grieve it, whether it's privately or having that conversation. And as parents, we might have to check in with our kids. How do you feel about all that? This must be a lot for you. How do you feel about X that, didn't happen, your senior year of baseball or lacrosse, or
wow, that's right. The sports even. I didn't even think about that one.
Your musicals, your
musicals, and all those kids that spent hours and hours to get ready for all of that, for sure.
So maybe you ask your student who plays an instrument, play me a piece that you were that was going to be in your concert, or for your students who were maybe in a production, or have them act out their part. Here's what can we do instead? And we're, like I said, we're still going to do some of those things. There was a mom on Facebook who suggested, let's have all of our kids have a dance and get them together, because if things continue to be canceled, maybe we're going to have to look at things in a different way. That's all right, but we may need to permit kids permission to talk about that.
Yeah, absolutely. Well, thank you so much for your work. And I know it's going to be really busy over the next few weeks for you and the people that you're working with to help with all the issues that are coming up every day. I'm sure it's changing for you. So thank you for your dedication and your service for our families. We just so appreciate it.
Thanks for suggesting it, Mary Beth. I think it's important for us to talk.
Absolutely. All right. Well, you take care. Stay safe. Be well.
Thank you. You too.
Take care. And thanks everybody for listening in to Parent Academy Real Talk, our first virtual session. And we'll be back for more soon with more information that parents need to know about through this time of crisis. And we just thank you for tuning in today.